Hello, I'm Dr. Kathryn May. It's October 28th and there's a big storm bearing down on the east coast of the US, but I'd like to make this video before the power goes out. I have something I want to teach you. It's called visual centering, and it's going to be very helpful to everyone who's struggling with what's happening on the planet right now, or anybody who's ever struggled with anything having to do with anxiety or self-doubt, or if you want to just be better at everything you do and feel more solid and secure and steady. I was taught this technique, which I call visual centering, about 40 years ago, and I've been practicing it in my private practice as a psychologist ever since. But the time has come for me to teach this to the world, to get it out there to everyone who can benefit in as quickly a way as possible. So I hope this goes viral, and I hope everybody learns to do it and finds a way out of their snarls and their difficulties from childhood and their anxieties, because the temperature is rising on the planet, the vibration is rising, and it's kicking up all kinds of difficulties for a lot of people. And I can't possibly see enough of you in my office to help all of you who need some help right now. So I hope you enjoy this. I'm going to be showing you some of the techniques myself, and then I've asked volunteers to also sit here and be videotaped so that they can demonstrate for you how this is done. The technique of visual centering is based on the understanding that children develop visual acuity very early, even by 3 months of age. And from then on, we learn to adapt, reconfigure even, our neurology in order to compensate for what's going on around us. Some of us have to learn to not see too clearly because we don't like what's going on. We learn to monkey with our vision, to become less secure, less confident in what we see, to the point where many of us may even reconfigure our eyesight to make it less, so that you become basically less perceptive. So I'm going to show you, for instance, the deer in the headlights look. Now, someone who's been scared out of their wits will develop this forward position where you push your focusing up against the back of your eyes, and it looks something like this. Let's see if I can demonstrate it for you. The deer in the headlights look is a little bit like this. You've probably seen this before in people you know, or even in yourself. Yeah, you can't think when you're feeling like that. It's up close, everything's larger than life, and you feel anxious. Okay, it hurts to do this, but I'll try and demonstrate it for a minute more for you. Can you see that? That's way forward, way anxious. Now, I'm going to move back to my normal setting, which is in the center of my brain. Now, if you think of the way your brain works, our eyes are like a camera. Or actually, we design cameras to work like our eyes. And when you focus, you use your eyes. You take the picture with your eyes, but you take the information along the optic nerve back into the center of your brain, where you process the information. So we literally see with our brain, not with our eyesight, not with our eyeballs. So in that process, as we grow from early infancy to adulthood. Our brain grows from, say, the size of a little baby, like this, to the whole brain of an adult. And along the way, we have to adapt day by day as the neurons are laid down channels in our brain to process what we see going on around us. Now, a child at 3 months can see as well as an adult, but they don't know what it is they're seeing. So, day by day, we have to adapt our settings to focus farther and farther back as our brain grows, so that we can remain in the center of operations, which is back here in the center of our brain. But along the way, a lot of us get derailed. You may learn to put one eye out of commission. Often it's the right eye. It's hard for me to demonstrate that one, but many people will have one eye that kind of wanders off to the side, doesn't focus too clearly. It's very common, especially for people who are helpers or who are a little anxious, who want to reach out to others but who are a little afraid or doubt their own abilities, are a little afraid of contact with others. Many of us adapt in complicated ways to make life easier when we're a little fearful, a little hesitant, a little shy. Those tendencies show up in our visual circuitry. And the fastest way to fix it, along with going to therapy, which is also a good technique. Psychotherapy is terrific for a lot of people. But to make permanent change and to make it stick, we need to be able to literally rewire the circuits in our brain so that the changes are permanent. Now let's talk about how we can do this. If you think about the way a child lays down the tracks, the processing literally in our nervous system, in our brain. If you've been frightened, upset a lot, disappointed, confused as a child, you tend to develop glitches along the pathways. And those glitches will show up whenever something similar happens to you as an adult. You'll feel yourself, you'll feel those things being triggered, and boom, it's like you're back there again, feeling the same things you felt as a child. And with it comes the feeling, the thinking, the experience of yourself as if you are that child again. That can be explained by the geography of our brain. It depends on where you're focusing. If an event in your life inspires fear, and if you had a fearsome childhood, you'll probably be thrown back into the place where it was the worst in your childhood. That's awful, isn't it? Where you feel helpless, overwhelmed, anxious, or angry, or even go blank. Those are all symptoms of the fact that you're in a child place in your brain. And we could, I hope that this video will encourage someone with an MRI to look at these things. Because we could see it. We can see brain dynamics on an MRI, but so far they've tried to develop, what the brain looks like and not what an individual actually does with their brain when they're feeling anxious, at least not to my knowledge. I'd like to do that. Since we don't have an MRI here, I'll show you what I see. I spent many years learning this technique, and as far as I know, I'm the only one who's teaching it. And I'm not getting any younger, so I want to put this out there so that there must be some of you out there who would like to learn it and teach it. It's the most effective technique I know of to help people change and maintain that change. So here goes. Think of your brain as this wonderful computer processing unit, but we don't have evidence in our MRI scans of where your soul is or where those connections might be to a higher power. Well, I can tell you where it is. It's in the center of your brain. And if you pull back into the center of your brain and you focus there in your center of operations, where you're most clear, most intelligent, most creative, you will experience yourself differently. So we'll call it the center of operations, where all your senses, all your intelligence comes together. And in that place, you can see, hear, feel, think, breathe, remember, and also add intuition and what you feel in your heart. They all come together in the center of your brain. And if you're operating there, in that center place in your brain, if you were to put a measure into the center of your brain, you want to be straight and level on every plane. And in that place in the center, just above and behind the corpus callosum, which is the neurological superhighway in your brain, that's where we are. The part of you think of as I, the self that you are, your authentic self. The one who keeps track of where you've been, what you know, what you felt, going back to the moment you were born and beyond. In that place is what athletes, being in that place is what athletes call being in the zone. And our goal is to get there and stay there. A lot of people who meditate find that it's easier for them to get there. But if you practice meditation with your eyes closed, then you open your eyes and go out into your life, you're not likely to keep it as effectively as if you learn it when you have your eyes open and you're walking around. So I'm going to teach you this walking around technique that will allow you to use it all day long, every day, and even when you're sleeping. So let's start with breathing. Breathe so you can feel yourself breathing. Feel the air passing through the nasal passageways. Feel the tingly sensation. That sensation of being alive and happy and well. All your functioning on all your cylinders. And now as you breathe, feel the sensation of literally pulling your point of focus back into the center of your brain, like the captain at the helm of his ship. Back there, overseeing, managing, calm, steady, present, and completely awake and aware. Breathe. Pull back into that place in your brain where you are the center of your being, the center of who you are, of everything you know, everything you've ever learned, and you're also connected to beyond. That third eye, crown chakra, and connected to the universe. In that place, you can feel you can experience, not just feel, you can experience the presence of your guides, spirit, the helpers who would be more than happy for you to call on them. But meanwhile, if you don't feel that yet, you'll be at the top of your game. In everything that you do, and especially when it comes to managing your emotions. Contrary to popular belief, it's not possible for a human being to be simply rational without feeling. There's no such thing. So this being in the center of your brain allows you to have the power of your emotional intelligence as well as physical presence, sensory input, and especially intuition. So open your sights, and now as you breathe, use the technique that I think is most helpful for a lot of people. You know, when they make a film, they put the camera on a dolly, and to do a close-up, they come forward. To do a wide angle, they move back. Feel yourself literally moving your camera back. Back to the center of your brain, where you feel peaceful, steady, content, but in a very lively, aware, and awake mode at the top of your game. Pull back, breathe like a steady breeze through your brain, and feel yourself moving back. Back, 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 until you fall in, like falling back on a feather bed. Breathe. And put your anchor from the center of your brain down your spine, down the center of your body, the center of your heart, down through the center of your legs and into the earth. And anchor yourself in the earth. Steady. Anchor deep into the earth. And breathe. Now, in this position, you can do anything better. Imagine yourself skiing, playing basketball, anything you like to do, even walking. You'll be stronger, calmer, steadier. Now I'm going to ask the next person who walks through my door to do a demonstration with me to show you the difference between someone who is used to focusing like this and you're going to watch them move back. Let's see if we can. All right. I'm going to come forward now. There's the deer in the headlights, look. Now, I'm going to pull back little by little. That's part way. All the way back to the center of my brain. Now, in the center of your brain is, I'm going to pull back a little bit with the camera so you can see my whole face. in the center of your brain is the place, your happy place. It's like, it's the place where you tell jokes to yourself. It's the place where you chuckle when you look around and see the silliness that's going on in the world. It's the place where you can laugh at troubles, where you can ride out the storm. So let's end the video here, and I'm going to make another part to this video, which will be someone new demonstrating how to move from way up here to back into the center of your brain and what it feels like when they do it. I hope you enjoy this. Now the next piece of this video will be someone else sitting in this chair, and I'm going to be coaching them to move back, and you'll see how it works. Now, P.S. There are some people who don't need to move back. There are some who are already too far back. But those people don't usually come into my office. They're the ones who are like this. Sorry. They're the ones who, let's see if I can get closer again. The ones who look like this. This one's a little harder for me to do. There. Let's see if I can get this a little closer. Okay. They look more like this. Those people you don't want to deal with. If you come across somebody who looks like this, run. And go find some people who are laughing in their brain, who have a sense of pleasure at being alive, confidence in what they're doing, know who they are, and feel happy inside their skin, like you're going to be after you learn how to do this. Okay. Next time, we'll have a volunteer. Bye-bye.